Mr. Chairman, Representatives, thank you very much for the opportunity to speak to this legislation. My name is Dr. Ryan Whitted. I am an ophthalmology resident, that's an eye surgery resident, at Vanderbilt University. My father is an optometrist. He's been practicing optometry for more than 35 years outside of the state of Tennessee. I have nothing but the utmost love and respect for my father and for optometry. I still remember as a kid, he took me into his clinic and showed me how to do an eye exam. I remember a kid named James, he put glasses on, and I watched James cry because he could suddenly see the leaves on the trees. It was very clear to me that I wanted to pursue a career in eye care. With that, a decision presented itself. Should I pursue optometry and follow in my father's footsteps, or should I pursue ophthalmology and become an eye surgeon? And it was a big deal. It's a big decision. My father and I spoke at length about the differences between the two fields and the differences in schooling. Optometry students pursue 4 years of training after college, whereas ophthalmologists pursue a minimum of 8 to 10. That's more than double the years of training. And to a 21-year-old guy, that's a big deal. There are similarities between our training. We both learn how to prescribe glasses, we both can prescribe contacts, and we both learn the general eye exam. But when it comes to surgical procedures, there really can be no comparison. We have hundreds of surgeries and hundreds of procedures where we are the primary surgeon, all the while with one-on-one supervision by a practicing eye surgeon, a practicing ophthalmologist. That is incomparable. As I mentioned, I am a little more than halfway through my residency at Vanderbilt. I have already done 4 years of medical school, 1 year of general medicine/surgery internship, and 3 years of ophthalmology residency once I'm finished. In that just 1.5 years of eye surgery residency, I've already been a part of 334 eye surgeries. Of those, 142 were eyelid surgeries. I can tell you from experience, there are no simple eyelid surgeries or surgical procedures, however you like to call them. I can say with great humility, even after doing all of those cases, still I would not feel comfortable operating independently without that supervision. That's the whole point of the system. I have seen the transition from medical student to intern to first year to second year to third year, and as I go through, the changes are not subtle, but they were not recognizable until I had gone through them, and then they became apparent. Surgery is not something that can be learned just in a wet lab. It is not something that can be learned practicing on your classmates or doing a brief externship. Surgery is learned through years of training, with hundreds of procedures, diverse pathology, all with one-on-one supervision. It is alarming to me that a state would legislate these privileges. With the stroke of a pen, people who graduated school years ago and may not even be doing injections will instantly be given the privileges of a surgeon. Surgery is not trivial. It's not trivial to me as a trainee. I still get anxious about it. It is a big deal. What we're doing will permanently change that patient's face, and the diagnosis associated with that biopsy or that excision may change their life. If you'd be so kind, I'd like to make one last point. In medicine, they teach us that if you're ever presented with a question, with a time where you're not really sure what would be in the patient's best interest, they encourage us to imagine that our father or our loved one were the patient. And so I imagine, and I'd ask you to imagine, what if your father had a lesion on his lid? Because that's what motivated me to speak today. What if it was my father? How would you feel if an optometrist wanted to surgically excise it, knowing that they did the mannequin training, they injected their classmate, and they did do an externship? Maybe they have even done this procedure before. Maybe not. There's no set curriculum for numbers. They've had contact hours and that's it. How would you feel? Would it be worth it to you to take your father or take your loved one to an ophthalmologist, someone you know has done hundreds, if not thousands of these surgeries? Would it be worth it? Would it be worth a slightly longer drive? I can say wholeheartedly for me, it would be worth it because I want nothing but the best for my father. I would make that appointment and I would do the drive, whatever I had to do. This bill is not in your father's or your loved one's best interest. It is not in the best interest of the state of Tennessee, and the people of this state deserve better. They deserve a standard of care that this bill does not provide. Thank you.